Hello, my name is Carly Nettleford, and I'm an Engineering Policy Advisor at the Institution of Mechanical Engineers.
Hi, my name is Antonis Sergis. I'm a research fellow at Imperial College London.
Great, and Antonis has done some very interesting research. So I'll begin by asking you, what brought you to do this research?
Well, routine dental treatments represent one of the highest clinical risks for aerosol generation and viral transmission. And at the onset of the COVID-19 pandemic, the UK dental care had been effectively reduced to acute emergency care provision at dedicated centres only. The need, of course, for dental services remained. During the first lockdown in the UK, approximately 80% of all non-respiratory calls to the 111 service in London were due to dental problems. Of course, since then, dental services actually resumed, but with limitations. They integrate social distancing, enhanced personal protective equipment, and you need to allow for lengthy surgery decontamination periods between dental treatments. Initially, we were contacted by Professor Owen Addison from King's College London, Faculty of Dentistry, to join his team and research this topic a bit more. The team from Imperial was comprised from myself and Professor Yannis Hardaloupas, and our work basically focused to understanding the generation of these dental aerosol generating procedures and devise new mitigation methods to reduce transmission risks. We have performed experiments at Guy's Hospital, and we carry on these experiments. And we got a significant amount of help, access to equipment by LaVision and Fotron. And the project has been funded and is continued to be funded by the British Endodontic Society, EPSRC, and Guy's and St Thomas Foundation Trust.
So my next question is, what risks are involved with dentistry, and how did you go about investigating them?
Well, there are many risks involved with dental operations, and there's a huge risk of infection. We have studies that show that about 1 milliliter of saliva can contain many million copies of the coronavirus, and you can understand that each copy has a capacity to infect a healthy person. Typical dental instruments, so these are your usual dental drills and your ultrasonic scalers. These are used for cleaning the teeth. For example, they generate sprays, and these sprays are comprised of the cooling water used by the instruments themselves, and which mixes with saliva and debris such as blood, tissue, etc. And then eventually part of it, a large part of it, is actually sprayed out of the patient's mouth during a dental procedure. Millions of droplets are produced from such procedures, and these droplets, they very, very quickly spread and can fill up rooms and surgeries. This sprayed material is suspended in air, and if you have a poorly ventilated room, it can remain in the air for hours after a treatment has finished. These droplets are usually invisible to the naked eye. So our experiments focused on advanced optical diagnostic techniques. We used lasers and high-frequency pulsed LEDs in combination with special optics and high-speed photography to be able to see these droplets in air and then analyze them. We have recorded the space with a high-speed camera. We used about 6,400 images per second, and then we process each of them to quantify the trajectories of these droplets inside the sprays and their probability density functions. We also used specific instruments that can actually count the number of droplets in air, and we use it to understand how much organic material you might be having released in the room.
So my next question is, what types of drills did you study, and what affects the rate of transmission of the virus?
Well, in the published work, we investigated dental drills. Two types of drills were considered. An air-driven drill, they're called air turbines, and these are by far the most common types of dental drills found in dental practices all over the world. And then we examined a new type of drill called a micromotor drill, and this is powered by electricity. Air turbine drills, they operate at fixed rotational speeds of around 500,000 rounds per minute. whilst micromotor drills, they can operate at a range of speeds that can be adjusted by the dentist. We simulated common dental procedures inside and outside the mouth of a dental training mannequin, and we found that the sprays generated, their propagation and their generation processes are extremely complex and very hard to predict. We found that the type of spray created and how it spreads inside the room, it depends on many parameters. For example, the location of the drill inside the mouth, the treatment type, the room size and ventilation, the location of the patient within the room, and others. By far, the worst offender was the air turbine drill. This type of drill produced very fine droplet sprays, which propagated with speeds ranging around and in excess of about 12 meters per second. So we have discovered that with a modified operation of the micromotor drill, we can significantly reduce the amount of fine spray produced.
So my final question would be, how would you assess the importance of this?
Well, the complexity of dental sprays has been realized for the first time, and at a time that was very difficult to perform experiments. It was possible to offer understanding of dental sprays and provide mitigation routes to limit them and hence reduce their infection potential. The findings and guidelines published are expected to affect policy drafting, not only in the UK, but also at a global scale. The results published in the Journal of Dental Research, which is a prestigious dental-related journal, and they have already been included by documents produced by the Scottish Dental Clinical Effectiveness Programme, the Faculty of General Dental Practice, and the College of General Dentistry. The press release of the publication has been shared by at least 18 international news agencies and health organizations, so we can see the impact expanding beyond the borders of the United Kingdom. Of course, this has been a unique collaboration between engineers and dental specialists at a difficult time, admittedly. The collaboration has been successful and is already continuing and extending beyond the current pandemic.
Great. Well, thank you very much for your time today, Antonis.
Thank you very much for having me.